I want to thank everyone for tuning in today to our live panel discussion. We're going to have a couple of different people that we'll be talking to. First, we'll be talking to Dr. Joe Smith, Chief Medical Officer for AdventHealth DeLand. And after that, we'll be talking to several people, including City Commissioner Jessica Davis, who have had COVID-19 and what that experience was like. Others who will be sharing with us their experience are Lola Gomez, photographer for the Austin-American Statesman and previously with the Daytona Beach News Journal, and Kara Cummings, marketing manager for the School of Business Administration at Stetson University. But first, we have Dr. Joe Smith. Good to see you again, sir.
Hey, good to see you too, Chris. Thanks.
You know, I looked back and we actually talked about 3 months ago in April. It seems like forever ago. First, I just want to ask, how are you and the staff of the hospital doing?
We're good. We're busy, but we're certainly adequately staffed. We have all the PPE that we need to take care of patients with COVID-19 or with other issues. We're doing our elective surgeries again and are very much open for business. But yes, it's busy.
Yeah, and I know there's been a lot of talk about the hospitalization rate, you know, across the state. Can you share how AdventHealth DeLand's capacity is? You know, what are you seeing with patients? It seems like a lot of younger people are contracting the virus now.
They are, and you know, I have a little bit to say about that. We are seeing a younger cohort of patients who have this virus this go around. But I want to reiterate that this virus doesn't discriminate based on age. So some of the earlier outbreaks or hotspots were in the skilled nursing facility setting or nursing homes, rehab facilities where you had more seniors. And really, I think the magic there is that it's a lot of people living in fairly close quarters. Now that we see really, you know, very confirmed community spread, this is a virus that's really striking all age groups. And all demographics. So while we are seeing that as the numbers increase, and we are seeing a little bit younger mix, really more reflective of the average age in Florida, which is about 40 to 42. We are also seeing, though, that as those numbers climb, the case fatality rate or death rate from this virus is actually continuing to decline. And that's something that I think is reflective of perhaps yet to be described scientific phenomena. Perhaps the people that contracted this in the first wave were somehow more susceptible. I think that there is also a significant element that we in the healthcare profession are much better at identifying this disease. At AdventHealth DeLand, about 75 to 85% of the patients who we identify as having this virus are actually able to be discharged from the emergency room and treated at home. The patients who are coming into the hospital, we're seeing that overall we're putting less of those patients into an intensive care setting. Most of those patients are doing quite well with supportive measures that you would use for any respiratory illness and are able to go home without going to the ICU or being intubated or placed on a ventilator. So overall, this is a bigger number of patients that we're seeing, but we're seeing a less severe illness.
And would you say that that's because what have you learned about the virus? I know, you know, in April we were just kind of, you know, learning things about it. Like, as far as how you guys treat COVID-19, what have you learned during this process?
Yeah, I mean, you go back, we talked 3 months ago, and I was just now getting into the place where I could do things for patients like remdesivir or convalescent plasma infusions. We've learned a lot about a very low-cost, low-tech approach, which is called proning, where we place patients on their stomach during most of the day. And that's whether they're breathing on their own or we're breathing for them. And that has been remarkably successful. We have seen treatments come and go, but I think the biggest win is that we are much better at identifying this disease earlier on. And then we can start to reduce that inflammatory response earlier on in the course of illness and help patients have a better course.
And I know there's, this will be the last question for now. You know, we're seeing a lot of comments and it's become sort of a political issue as far as mask wearing.
Masks, yeah.
And governments like DeLand are moving toward a mandate. I think we can all agree there has been a bit of mixed messaging on the matter throughout the pandemic.
Sure.
What would you say to people on what they should be doing to protect themselves?
Okay. Great question, and I'm glad you asked, because this is something that we can all do. AdventHealth and I personally, as a physician, strongly advocate that people who go out into public wear a mask, okay? Some type of face covering. It does not need to be an N95 mask. It does not need to be something special. It could even be a homemade mask, okay? But the importance of the mask is that when we speak and when we cough or sneeze or sing or laugh or anything that we do that makes air leave our nose and mouth, okay, we are dispersing tiny little droplets out of our mouths. And nobody wants to think about it. But as we are speaking to each other, those tiny little droplets are landing on my keyboard or perhaps on your telephone, and they're out in the community. If those droplets have COVID-19 in them, somebody could very easily come along, maybe touch the handle of a shopping cart or pick up something you had touched or coughed on, touch their eyes, touch their nose, and they could become infected. The mask prevents those droplets from leaving your mouth, okay? And the ones that do leave stay much, much closer to you. If you were to sneeze, for instance, the droplets that leave your mouth and nose when you sneeze travel at about 100 feet per second and can go about 25 feet, which means that just in the fraction of a second, it's across the room and you've covered the room. If you wear a mask, you diminish that dramatically. So I absolutely advocate wearing masks. I think that as a healthcare organization, AdventHealth has a duty to educate the public to wear the masks. It's a very cost-effective, just easy thing for all of us to do to reduce the spread of this virus. So please, if you're going to go out, wear your mask. The mask is not a free permission slip, though, to disregard social distancing, and it's not a free permission slip for you to not wash your hands, okay? You still need to take care of your hand hygiene, not touch your face, and it's important maybe stay about an arm's length or more from each other when you're talking in groups. But the mask dramatically reduces that risk, and I think it's extremely important.
Thank you for adding that to the discussion, and I appreciate AdventHealth for participating in our Step Up Volusia campaign. You know, we launched a couple weeks ago, and so far it's been going well. And really, yeah, I think everyone can agree that, you know, if we work together, we can help stop the spread.
I think so. I'm confident we can. In fact, we know we can. We did it before.
And so now we're going to switch gears here a little bit, and Dr. Smith is going to stay on with us, but we have a couple of people who have had COVID-19, and I asked them personally to share their experience. So we have Commissioner Jessica Davis with us. And, you know, I know it was kind of a lengthy process for you, Jessica. Just share your experience, what it was like. You know, I think there's a lot of people that, you know, they're unsure of what they're going to be dealing with. And I think we're going to see with our other panelists that this virus affects people in very different ways.
All right, good morning. Thank you, Chris, for having me, and because I feel this dialogue is extremely important because it's developing. My experience was not something that I ever experienced before. Many people feel that it's similar to a cold. I've had a cold. It was not like a cold. I was first diagnosed with bronchitis, and I received medication for that. But I've had bronchitis before as well, and it just the symptoms did not ease up. So I went back to the doctor and I was diagnosed with pneumonia. I received medication for that. The symptoms did not ease up for pneumonia as well. So because COVID-19 was happening, I felt like I did have it, but I just, you know, I'm not a healthcare professional, so I was trusting the doctors to know. They did administer an antibody test for a finger prick that was negative, and I was advised that that finger prick will tell me if I had COVID or had COVID. And because it was negative, I just was going along with the bronchitis and pneumonia. I read some articles about some individuals down south that were dying from pneumonia and bronchitis diagnosis who actually had COVID. So I went to the hospital. This is my third visit seeing a healthcare professional, my second visit to the hospital. At that time, I requested a nasal swab. I requested that they test me for COVID and that I actually, you know, receive this information. The nasal swab came back positive. I was put in the hospital for 4 days. And during this time, and the entire time, I had the symptoms of shortness of breath, which is the scariest because I don't have asthma. I never really felt shortness of breath. So the feeling of you can't breathe is another level. Fever, fatigue, cold chills, coughs. I had all of those symptoms. While in the hospital, I received vitamins, basically zinc, vitamin C, vitamin D, medication to try to help ease my cough. But there's, of course, no vaccine, so there wasn't anything really done. So I was advised once I was discharged to walk, get sunlight, continue the vitamins, and just do my best to continue to push the virus out of my lungs. So twisting, turning, basically exercising and trying to build up my immune system to fight the virus on its own. So I did all of that, and it just gradually started getting better. I continued to get tested, and I was testing positive for about a month, and then I received a negative, and then I took another test and received a positive because it all depends on how the nasal swab is administered. One location did both nostrils, and another location did one. So just a lot of learning for healthcare professionals as well as myself. But basically, your body heals on its own, and you will know because the symptoms start to disappear. And that's kind of like a telltale sign on whether you have a test or not. So that's why many are encouraged to just quarantine, and your body will tell you that you're feeling better. So I am COVID-free at this time. I don't wish this on anyone. It is very serious. I am a supporter of wearing a mask. I don't care about the details of wearing a mask. Just like Dr. Smith said, make it at home, wear it. If you need one, look online. There are many masks given away for free. We need to take this virus serious together. I'm extremely afraid of those that are ill-informed. I'm a teacher as well. We are encouraged to go back to school in August. That's scary. Scary for myself as a teacher, scary for my daughter who is a student, and all of those that will be involved in this process. I really feel no amount of PPE can really prepare us for what's to come. That's my opinion. I'm sticking to it because I am looking at the data. The numbers are rising. It's for real. You can't follow those that are not informed. You cannot follow those that are just guessing on what it should be and putting our life in jeopardy. And I've made that vocal at city commission meetings. I've made it vocal on my Facebook page, and I'm making it vocal now. Do not ignore this. You can be affected, your loved ones can be affected, and you can die. Thank God I'm a survivor.
Thank you, Jessica, for sharing that. And we'll have Dr. Smith on throughout this entirety. So if you have any questions, Dr. Smith, please feel free to ask them. I'm going to go to Lola now. As she actually got the virus pretty early in the process of when the pandemic broke out, and she was actually in the hospital for quite a while. So Lola, can you just describe kind of what you went through?
Yeah, thank you for having me here, Chris. I concur with Jessica. It was kind of the same experience, but I'm asthmatic. So I know the difference between what is to have COVID and asthma. It was not the same. Definitely every asthmatic person who could say that definitely it's not the same. The shortness of breath is totally different than an asthmatic attack. I started to have the first symptom in March 19. The first symptom was fever, and I am a person who never developed fever for anything. So it was weird because even when I'm being really bad with any infection or something, it's difficult to tell because I never have fever. So this time I had it, and it was the first symptom, and it was a really big red flag for me. But as you said, it was really early when I had it. And at that time, I tried 5 times to get tested, and I couldn't because I was not meeting the criteria at that point. I'm 43 years old, and I don't have any medical history like a severe, only asthma. And they said we don't have tests enough, like, for everybody. So we are saving the test for people over 65 years old with a severe medical history. So I tried 5 times. The time that I had the test was when I was in the ER with my oxygen on 66. I was coughing really bad. I couldn't breathe at all. It was a really terrifying experience, to the point that I had to call my family, my sister, saying, we have to tell my mom because I think I'm not gonna make it. I can breathe. My body was getting numb completely in the ER. And as I said, my oxygen wasn't 66. So they put me oxygen immediately. And I remember it was really painful because it was really fast over my nose, and it was kind of burning all my nose inside. But yeah, I stayed in the hospital for 3 days. Luckily, I didn't have to go to the ICU because I respond to the oxygen immediately. There is not any treatment for this. What they did was to stabilize all my symptoms. But yeah, it was terrifying. It took me a whole month to get out of all the symptoms. I had fever, fatigue, same as Jessica, cold chills, shortness of breath, coughing. I had the lack of smell and taste too. And the hospital, I vomit, I had diarrhea. So everything goes like kind of every step, one day something new until everything is going like slowly and easy. But yeah, it took me an entire month to get back to normal, but I'm still working. I'm a runner. So my primary care doctor said that I can run because my oxygen level is not getting good when my heart and my breathing is high. So apparently it's possible that I developed some kind of micro blood clots when I was positive with the virus. And right now I have to wait until August to go back to run. So I have to go really slow. Right now I'm walking, like kind of an exercising, just walking a little bit every week, something like progressive. Because I can't put my body last week I took my the oxygen level in my blood when I was walking, and I got until 83. So when I'm working or doing something different, like I'm fine, but when my heart and my breathing is high, my oxygen level, it goes down. So definitely, yeah, I'm with Jessica. Definitely, this is a serious disease. This is not just a cold. Everybody responds differently. I'm a healthy person, and then suddenly I ended up in the hospital. So definitely you have to take this seriously. I'm still wearing masks. As I said in my Facebook, I'm vocal too about that. I do it more for you than for me, because definitely right now I have the antibodies. We don't know if that works. Definitely, we don't know yet if it's gonna last for a year or one more month. We don't know. So I definitely doing more for you than for me, because I definitely believe that this is getting worse here in Austin. Just recently, the city they are preparing the Austin Convention Center as a hospital for COVID patients. They are planning to have it ready for July 20th, which is a big red flag. The hospitals here probably are getting packed with people with COVID-19. So they are preparing the Austin Convention Center for 1,500 patients, which we don't want to get to that point. But if we don't take this seriously, this is the route. for everybody, not only here in Texas. Definitely in Florida, it's going to happen too if we continue this path.
Thank you, Lola, for sharing that. And we'll circle back to everyone. Just ask some follow-up questions. But we have Kara now with Stetson University. Kara is a CrossFit athlete, so I know she's very athletic, very fit. So kind of tell us your experience. I know it was a little different than what Lola and Jessica experienced.
Yeah, so like Chris said, my experience was a little different. I was very fortunate to have very minor symptoms, but I had also been doing a lot of social distancing, using a lot of soap, a lot of hand sanitizer, and wearing my mask when I was going out. So I'm really thankful that even with mild symptoms that I was able to prevent anyone from who was in contact with me from getting it. So I actually I kind of got to the point of thinking that I might have COVID, not because of any symptoms at first, but actually because of a wearable fitness tracker that I wear. So they had been releasing some information about respiratory rate as tracked by the app. So I was actually able to see when I woke up one morning that there had been a spike in my respiratory rate. So based on that, as well as potential conflict or contact with someone who had been COVID positive, I was able to go ahead and get a test early. I was fortunate to be able to get in very quickly to CBS, which was fantastic. It's a really easy process that they have set up. You go through the drive-through, no contact. So that was really nice. And I know a lot of people might be scared to get tested, but it really does not hurt that much. So I would say that if you are showing symptoms, please don't be afraid to get tested. So my symptoms actually developed about 12 hours after I had gotten the test based on those two factors. And in my case, it was sneezing and head congestion. So definitely very different from the loss of taste, from the coughing, fever, fatigue, those kind of things. But I think that's worth sharing, in that this virus can present itself in so many different ways. So you really have to be very aware of your body. I, like Lola, am an asthmatic. So this is something that I've been taking very seriously from the beginning, not only for that reason, but because I really value our community here in DeLand, and I don't want to just protect myself. I want to protect all of us. So I had 3 days of those symptoms, that sneezing, that head congestion. And then as an asthmatic, I did have a little bit of shortness of breath that I was able to use my rescue inhaler on after speaking with my primary physician. So my symptoms did resolve themselves pretty quickly. I've been back to working out in my garage and just taking it slow, making sure that I'm not putting too much extra strain on my lungs, given that they did carry me through something very difficult. But again, to parrot Lola, even though I do have antibodies, I am still continuing to wear a mask everywhere that I go, wash my hands or sanitize before I walk into a facility, and then do the same thing on the way out. Just because we don't know what this looks like. And those are really very easy things that we can do to do our part to stop this spread in our community, so that we can get back to seeing each other a little closer at some point.
Yeah, and I know Stetson University is really taking it seriously, as far as and my wife works there, and I think everyone's pretty much has to wear a mask on campus. Is that correct?
Yeah, I've been working entirely from home, so I actually have not been to campus to date, but seeing the efforts that are coming out of our leadership team and our Safer at Stetson team have been really reassuring.
Now, Dr. Smith, you are the medical expert here, so you may have, just for your own curiosity, you might have some questions for, our people who had COVID. So I'll let you ask any if you have any.
So that's a great question. I get to interview the patient. So Kara really interests me, the wearable device. I'd never heard that. That's a really interesting way to leverage technology to kind of make a self-diagnosis. I'm curious, did you just sort of put two and two together, or did you read about that somewhere? Where did that idea come from?
Yeah, so my device is called a Whoop, but it is a combination of a sleep tracker, recovery tracker, and a heart rate tracker. So since the beginning of this pandemic, they have been doing research. So they had actually released a blog post about it, just showing some people who contracted COVID early in this, and just kind of anecdotally what their metrics were looking like, just in case it was something to be aware of. So I was able to see that spike in respiratory rate, and then also it has a recovery score, which is kind of like a body battery. And I don't think I'd ever been below maybe a 40%. And that morning that I woke up with that high respiratory rate, I was at a 7%. So even though I wasn't really feeling it, it was able to tell that there was something off.
What I think is really neat about that is part of the way that we're able to exercise good stewardship of hospital resources is those patients leaving the emergency department are using home monitoring devices. And so I think there's probably a scientific paper in there for you. If you and Jessica and Lola want to put together a scientific team and write a paper, you could probably do that and sort of show the evidence for wearing a device like that. That's pretty neat. I was curious about you guys' mental health. How did this take a toll on you mentally? And we all know about fever and shortness of breath and GI symptoms and fatigue and the body aches, but how did it affect your mental well-being and spiritual well-being?
Yeah, in my case, oh, I'm sorry.
No, go ahead.
Okay, sorry. I'm a photojournalist, and since everything started, all the reporters are working from home. But as a photographer, we can.
Right.
You have to be out there. So in my case, when I had to go back, I remember I had to have an emergency kind of meeting with my therapist because I was crying. I was really afraid about going out again because at that point we didn't know, nobody knows how this can affect really after you have it, after you had it. So I remember at that point, it was when everybody was in different cities, they were protesting about the cities and governments, everything, all states were closed. So people were protesting about to open up the states. And they were not having any, care about social distancing, wearing masks, because, they think this is not real. So when I saw that in my city, where I live now, I remember I was crying. I was having a panic attack because it's really scared. I mean, what we had, the way that I had it, I felt that I was dying. I was almost done. So for me to go back again out there where the virus still out there, it was terrifying. And still for me, because my family lived in Florida, and for me, it's really, they are fine, but it's like, when is their turn? They're gonna be fine. The hospitals will have it right with them. It's terrifying.
You're really describing symptoms related to post-traumatic stress disorder is what you're describing, Lola.
Yes.
So it's a very traumatic event. What about you, Jessica? Did you have any, particularly I'm interested, did anybody treat you differently after they knew that you had this? Did you feel like people thought, oh, I can't be close to her, I can't support her? Did you feel isolated in any way afterward?
Dr. Smith, this is a great question, and thank you for asking, because I'm an advocate for mental health. I've never had any mental health issues, but being a teacher, we often have training for it, how to handle students, but I've never dealt with it myself. However, the day I was discharged from the hospital, that night, I got a hotel separate from the family, trying to finish quarantining. I had a breakdown. I didn't know how to recognize that what was going on with me. So my immediate response was shortness of breath. I didn't realize this was an anxiety symptom. So when I had shortness of breath, just like Lola, oh my God, I'm about to die. I don't have a ventilator here. I never had to go on a ventilator. I'm only 36 years old. But immediately I went into full panic mode, like 2, 3 o'clock in the morning. I went to a different hospital because I'm like, they discharged me and they shouldn't have. And why would they do that? So I'm thinking it's the hospital. I'm just like mad at everyone. I'm afraid, jump in my car. To keep in mind, I'm sleep deprived because I barely got any sleep in the hospital because it's difficult to sleep when you have shortness of breath. So all of this is going on. And I have been vocal about my anxiety attack once I realized what was going on, because my oxygen level when I went to the hospital was in its 90s. It wasn't perfect, but the doctor's like, you must just be stressed. So I was like thinking like, what do you mean stress? And he never used the word anxiety attack, but talking to someone later, a medical professional who was a therapist, said that's what was happening. They basically described what was going on with me, prescribed me some medication to help me sleep and help me relax because the body needs to sleep. And I wasn't doing that. So I've been vocal about that in the Beacon, the news journal. I told my story because I don't want people to think that having a health crisis like what I was going through in that moment is something bad. And yes, it's been a stigma against myself and my family. Oh, no, we're not going to invite them over, which is fine because I do not want to go to your barbecue or function after surviving COVID. I don't even want to go to a meeting, so I'm okay with you discriminating against me for your party, but at least be informed on why you're doing it, because people are just kind of don't know why or what's going on, because the person at your barbecue can actually have COVID and not know it, give it to you. It's not me. At least I'm telling you I have it. What about those that do not have it? When I did become vocal about it and it made the paper, I received inbox from coworkers that actually are battling it now, but they're not vocal. No one is talking about it. So throw us back into the school. You don't know who actually had it. And there are some people that I know that have it now or have had it. I just chose to be a front runner on this because it's serious and I don't feel enough people are taking it serious. I just looked at the Facebook Live comments. Those that are looking at us now, take it serious. I know you may take things as a joke, but don't be that person. This is extremely serious. You have Dr. Smith on here. You have COVID-19 survivors telling you this. I'm a city commissioner. This is not exciting for me. I don't get paid to do this. I'm trying to inform someone else so we can stop the spread. Simple.
I think that's an important message, Jessica. You are all healthy, fit young ladies. Okay.
I wasn't fit. I will take that back because I'm not as fit as the other two ladies. I am a little overweight, and I'm okay with saying that. I'm working on that now. But I am only 36, and for a while they were saying that my age group didn't matter. But obviously, I'm healthy enough to have. I did fight the virus out of my system, but at the same time, I don't really know if it's all the way out. Like Lola said, we may still have some complications. For one, I do not take any medication at this time for panic attacks, but I did shortly after being discharged because it was stressful.
But I think it's important to know that healthy, young, fit people, people who are going about their lives, professionals, this virus doesn't discriminate. And the thing that I'm really worried about is there's sort of this idea that, oh, I'm under 65, I'm bulletproof. That is not true. And if anything, I want the public to see, these are the faces of COVID-19 right now. Okay, you guys are our neighbors, our teachers, our commissioners, your coworkers, your friends and family. You cannot look at somebody and say, hey, that person probably has this, or that person's probably okay. And it doesn't mean that you can go out and expose yourself and expect to get away scot-free. That's not the case. A young, healthy person can become critically ill. A young, healthy person can die from this virus. And so, the idea that you can just sort of avoid maybe mom and dad or grandpa and grandma. That's just not the case. And that's why I think it's so important for the healthcare community to advocate for the wearing of masks. You never know, as you just said, who is spreading this virus. Many people who spread this virus are completely asymptomatic. As of now, the healthcare community, the medical profession, we do not know why some people will have this and have no symptoms and can spread the virus, while others who on paper appear to be just as healthy as that person will become critically ill. And until we can predict that, until we have a vaccine, until we have herd immunity, I think that the best thing, the number one thing we can all do is wear a mask and continue to exercise social distancing and hand hygiene and just good common sense. Like you said, don't go to barbecues, don't go to large social gatherings. It's just not a good idea right now. But at the same time, I think it's important to remember that everyone is a human being and everyone is to be treated with courtesy and respect always. And if you have a friend or a coworker or a family member who has had this thing, check on them. They don't need to be treated like Typhoid Mary, somebody that's sort of isolated off in a corner. It just means we need to be a little careful. But it's also important to check on people. People who have experienced this have symptoms of PTSD. People who have experienced this may be even more isolated. We've all been a little isolated for several months, right? And if somebody's even more isolated, then they're probably feeling pretty alone. So check on each other and be good citizens, good neighbors, good friends to your family and coworkers. And I think that by doing that, we all come through this together. And I think that makes it a little bit easier to wear a mask, which, yes, you know what? It's hot. We live in Florida. It's a little stuffy. But it's in the scheme of things, such an easy thing that we can all do to help prevent the spread of this thing.
Yeah, and I think this has been a great informative session, and thank you, Dr. Smith, for joining us. I didn't really think you'd be leading the discussion, but I'm glad you were able to kind of be the doctor-patient there. Yes, it is something we need to take seriously. Even within the city, some of our we have some employees that are starting to test positive. And it's really going anywhere that it can find people that are susceptible. So, really, we're just asking that people just take it seriously and, hopefully we can get past this as quickly as possible. But Dr. Smith, I appreciate you coming on and joining us. I hope that everything goes well at AdventHealth DeLand. It seems like we did see a surge, but like you said, you guys are doing okay right now as far as capacity wise.
We are. We've never been more ready to take care of your needs. So we are very good now at identifying patients who are at risk of having this. We're making sure that people are, separated from patients who clearly do not have this. All of those processes have gotten a lot more hardwired. We're very quick now about putting on all of our gear, getting in and out of a room safely. All those are skills that we've picked up. We're also very fortunate at AdventHealth to be part of this large network of hospitals so that we can level load patients throughout our system, or materials, medications, whatever it is. If for instance, and I'm not in this situation, if I were short ventilators at DeLand, I could borrow from our sister hospitals, and we can do that. We can pool our resources as a national healthcare company to be able to bring those resources to bear in Volusia County in a way that I couldn't as a standalone hospital. And that's been really amazing. I will say, not to pick on my colleagues in Orlando system, which is the big mothership hospital, we've even taken patients from Orlando to Daytona Beach to be able to do that, so that we can respond to this virus across county lines as necessary. So it's been really a very rewarding experience to see that teamwork between our hospitals that's helped us to be able to make sure that we're able to not only provide care to people who come in through the emergency department, but we haven't had to stop any elective surgeries or any sort of routine health care, which a lot of people have been deferring for several months. And I think it's important that everybody knows that they deserve and have access to health care through AdventHealth.
That's all very good information. Again, thank you, Dr. Smith, for joining us. And thank you, Kara, Jessica, and Lola for joining us. It was really enlightening to hear about your stories, and I think people also appreciated you sharing your experience with everyone.
Thank you.
Thank you,
So,
Chris.
Yeah, so with that, we're going to end our session. It's available right now on Facebook Live, but we'll also edit it a little bit and share it later on social media. So look for that. But again, everyone, thank you and stay healthy. All right.
Thank you. Same to you.
Thanks, Chris, and thanks everybody for sharing.
Thank you.